Okay, welcome everybody to the Senior Center. I'm very, very happy and pleased today to have 3 students from Mass College of Pharmacy here to speak to you about safe and effective medication use. We have Tan, Rachel, and Abina is here today, and they are all under the fine tutelage of Paula Evans, a professor at Mass College of Pharmacy. So I'd like to welcome you all up here. And I'm going to turn this over to Paula. Thank you for coming, Paula.
Good morning, everyone, and we're happy to be here from the Massachusetts College of Pharmacy. We came down from Worcester, the College of Pharmacy in Worcester, and I have 3 students with me today. And my students are all going to be graduating in May of 2017. So they are just starting this week on a 6-week rotation with me. And when they're done with me, they'll go on to something else, hospital, and then they'll go on to community pharmacy. And so they're just getting started. This is their very first outreach and their very first few days. And I just wanted to let them introduce themselves and let you know where they're from. And then a little later, a couple of them will also be speaking.
Hi, my name is Tan. I'm from Vietnam and I have been living here for 6 years. I'm studying in MCPHS University.
Hi everyone, my name is Rachel. I'm from Pittsburgh, Pennsylvania. I went to Penn State undergrad and I studied biology, and now I'm here in the pharmacy program.
Hi, my name is Abina. I'm from New York, Long Island, and I went to Farmingdale State College. I graduated in biology and I'm here in Mass College of Pharmacy.
You can sit and then you can come up later, okay? Thank you very much. The pharmacy school in Worcester, just to recap it a little bit, I'm sure you know that we've been there now for about 10 years. It's actually a branch of the pharmacy school in Boston. And about 10 years ago, maybe longer than that now, 15 years ago, they started a pharmacy school in Worcester. But it's not just pharmacy anymore. There's nursing there, there's PA, there's physical therapy, there's optometry, and even it's going to open this year is a school of acupuncture. So that is new. And acupuncture, maybe they'll come down and give you a little presentation at some point, but they would talk to you what people would use acupuncture for. They would be very happy, I'm sure, to come down, have some students come down and talk about that. So it's a very nice resource. The students that come to pharmacy school at our school, it's a little different. In Boston, they would come right from high school. But as you heard my students mention today, they have a degree in usually a science program or something else. They've gone to college already. Now they're coming back to pharmacy school, and it's a 3-year program. So they start in September, and then they just keep going all around, all through the summer, and then they'll graduate in 3 years. So by the time they get done with this program, they've been going to school for 7 years, and they're very willing. They're very happy to get out, be done, pay off some loans, and get going. But I'm happy to have them here today too, and I'm happy to be able to present to you. So today what we're going to talk about is safe and effective medication use. And the whole point of this is just to make it safer for you at home so that you know what medicines you're taking. How can I remember to take my medicines? How can I make sure that I don't get into trouble by doing the wrong thing, taking too much or having problems with drug interactions or things. So let me see what safety tips we can talk about. We have a program at the College of Pharmacy, and it's called the Pharmacy Outreach Program. I have a red card up here that I'm going to pass out at the end of the program. It has our phone number on it. Marcia can attest that we answer numerous phone calls for folks at this outreach program. And so if you have a question about your insurance, why did this medicine get to be so expensive? It was $20 last month. Now this month it's $100. Any of those type of questions. We also answer questions on what is this medicine all about? Do I have questions about a side effect that I think I might be feeling about this medicine? Can you give me some guidance on what my doctor's telling me? I didn't catch everything at the doctor's appointment. All of those kind of things, we would be able to help. We're a small service. We have about 3 pharmacists on staff. We have some case managers. I always have students around. So our phone number, toll-free phone number, 866-633-1617. Again, I have cards to hand out at the end of the program. So today, excuse me, that's the red card. I meant to have that up when I was talking, but that's the red card. So today what I'm going to do again, as I said, I'm going to explain the importance of managing your medications safely, because we want you to be able to take them on a regular basis so that those medicines are just what your doctor ordered, just to be effective for you. We want to also give you some simple tools to help you manage your medications and your costs. So, avoiding over-medication and harmful drug reactions. I have a handout that we are going to be giving out at the end also, and this is going to give all of the information that I have on these slides. So anything you hear me say, you'd be able to follow up on a handout that I'm going to give you. Pretty much is saying if you're going to be buying something in the pharmacy by yourself, over the counter, if you're buying something you have aches and pains, or you have a cold, or you can't sleep, or you'd like some vitamins, good rule of thumb, always ask your pharmacist to make sure that there's no interactions, no problems with any of the medicines that you have. Good rule of thumb. Another good rule of thumb is keep a list of your medicines. Know what it is that you take. How many of you have doctors that give you a printout of your medicines and you keep that at home and you keep that in your wallet? Does anybody have a printout of your medicines that you keep? Many doctors' offices will do that now. If you ask them, they'll give you a printout of the medicines that you take. Your pharmacies would also give you a printout. But you need to keep a list. You need to know what it is that I'm taking. What I recommend is that you keep a list that's a printout, or you use a wallet card. We have very nice wallet cards that you can write your medicines on this and put this in your pocket. If you go to the emergency room, you can't remember what medicine you're on or your strength. It's very, even family members being around, it's a good, helpful resource to have a list. Review the medication list from time to time. Make sure that it is updated. Ask questions of your doctors. Many times the doctors, you'll say, well, they just don't have time. You know, I got 5 minutes in there, or 3 minutes, or whatever. But keep a list ahead of time. If you have a question today about something, write it down. So when you get to your doctor's office, you can pull out that list and use that as a resource to ask your questions from. That might help. Get organized. We have pill boxes that I have today that if you would like a pill box to help you keep organized, we can do that. I have these large white ones. I have some that are twice a day pill boxes, taking meds in the morning or night. I also have these very small ones here that you could, it has like 3 sections in it, but these are good if you're going out in the middle of the day, going out to eat with friends or so, and you want to put this in your pocket and make sure that you take that noontime dose, because sometime you may get home and say, darn, I'm going to take it when I get home, but then you forget to take it. So at the end of the program, anybody who would like any of these pill boxes, we'll walk around and make sure that anybody can get them if they would like them. Follow directions that are on your labels. Read your labels and make sure that you're following the directions exactly as it's listed on the bottle. And if you have problems, report the problems to the doctor. All of these helpful hints are on this sheet, and I will be distributing that. Other helpful hints are using one pharmacy. I I don't know if you go around to several different pharmacies. Sometimes people do to find the best price. Maybe that's not such a good idea in terms of you want to make sure that one pharmacist is looking at your whole list of medicines. Double check the label and contents of the bottle. I already went over. Never take medicines in the dark. If you are having trouble with that, if you need to take a medicine at bedtime, put your night light on. Make sure that you're taking something that you should be. Sharing medicines is also not such a great idea. You may be on a medicine that your friend is also on, but you don't really know that it's exactly the same. You don't really know that the strength is exactly the same. So be very cautious of that. If you're discontinuing a medicine, it's better to get rid of the medicine than to pass it on to somebody else. Taking medicines as part of a day-to-day routine is something we always recommend. If you're brushing your teeth in the morning and that's the way that you can remember to take your medicine, then maybe that's the best for you. Maybe that would help. Some people watch TV at night and they may take a medicine at bedtime, and they fall asleep watching TV and then they stumble into bed and forget all about taking the medicine. I don't know if that sounds familiar to anybody, but maybe a helpful hint on that is to put your medicine at your bedstand with a glass of water and leave it there. And then right before you get into bed, take your medicine. A lot of times you take medicines for the cholesterol at night, and you don't want to be forgetting that, and other medicines. So set up some kind of a system where you can remember to take those medicines. You can have a medication checkup from time to time. As I say, you can call our service. And what we plan on doing at the end of today, if anybody would like us to review your medication list, we would sit down and do that. I don't know if anybody brought your list with you or your bottles. But again, even if you don't have it, you don't want to have it today, you can call our service. What can we do for you is we would not be changing your medicines around. That is your doctor's call. What we do, though, is we would be able to look and make sure that you're not taking any medicine in duplication. We may be able to tell you a good time to take your medicine for the day, whether you should take it at night or whether you should take it with food. We'd be able to make sure you don't have any drug interactions. The other thing we always ask people is not just your prescription medicines, but your supplements and your things that you buy over the counter. They're all part of your list. And if we're going to do a medication review as a pharmacist, we would be looking at that whole list for you and giving you an indication whether what you're taking is helpful or maybe harmful. So a good thing, have your medicines checked up from time to time. And I recommend call us or we'll work with you at the end of the program today. One little thing on storage is just store your medicines in a cool, dry area. Medicines in a bathroom may be a little bit too humid in there. That may not be the best place to store medicines. Might be better in a kitchen or someplace that's a drier area. But it has to be a safe area. Medicines in a purse may be not such a good idea if you're leaving the purse open in your house and you've got younger people coming in and out of the house. You just never want to underestimate anything that could happen to some of the medicines, somebody getting a hold of them. Store them away from pets, of course. I'm assuming that the Uxbridge Police Station has a drop box for disposal of medications. Most police stations now do, and I see Marsha shaking her head. So that's what we recommend. Any of your medicines that you need to get rid of, you would could bring them there. They have usually they look like mailboxes, and you can just go in and drop them in the police station. If you're going to be putting them in the trash, you do need to black out your name, put some kitty litter or water in the bottle, and then wrap it up in a plastic bag and put it in the trash. You don't want to be putting medicines that you're not using anymore down the sink or down the toilet. That's the proper way to dispose of them. So make use of your police station here. Medications older adults should use with caution. I have another handout that I'm going to pass out, and it's called 10 Medications Older Adults Should Avoid or Use with Caution. This is a list that the American Geriatric Society has put together of medicines that may be harmful to people of your age. What they're saying is be cautious. And the first one on the list is ibuprofen or naproxen. Does anybody know what those medicines are? What's another name for them? What's another name for ibuprofen? Anybody? Aspirin? Aspirin could be in there. Yeah. How about Motrin or Aleve, Advil? Yes, that group of medicines. Now, not everyone older adult is it harmful for, but it is harmful for people. It could be harmful if you have high blood pressure, if you have problems with your kidneys, if you have a cardiac condition. It may not be, such as heart failure, they may not be as safe. Why? Because they may affect your kidneys and not be eliminated. It may also retain fluids, and so they're harmful to some of the older adults. Some people take them just sporadically. Maybe that may be okay. But if you're taking these on a regular basis and you happen to have heart failure, it is not the best medicine to take. The handout that I'm going to give you explains the reasons that I just went over. You can certainly bring this handout to your doctor's office and ask about it if you're taking it on a regular basis. Should I be doing this? A good medicine to be cautious of. The next one is some diabetes drugs, and the diabetes drugs that now are a little more cautious in older adults, although many people still do take them, is glyburide. If any of you are using glyburide for your diabetes, and the reason is that glyburide can cause very low blood sugars in older adults, and that would be dangerous for you, that there are now newer medicines that are safer. If you are on glyburide or you know somebody who is on glyburide, it may be perfectly okay for them. But some of the insurance plans are not even covering glyburide anymore. Some of them also have like even a prior authorization for the medication. So it's definitely a word of caution to look out for. Again, on this sheet that you can refer to. The third grouping of meds is medications for anxiety or insomnia. So some of the medicines that are used for anxiety, such as Xanax or Valium, those you have to be cautious of using in an older adult. You may become a little unsteady on your feet. You may become confused, and you certainly don't want to be falling. Very cautious with those. Sleeping pills such as Ambien and Lunesta. That's what they're talking about now with insomnia. Also, Benadryl, and I'll talk about that, the fourth drug. But some of those medicines are using caution now with older adults. Can make you confused getting up at night. If you have to get up and go to the bathroom, you can be confused and be falling. So you want to be word of caution on using some of those medicines. Also, a word of caution on using the last medicine down here, diphenhydramine, which is also Benadryl. That is an antihistamine. It is the medicine that is in a lot of, you can go in the pharmacies and buy that for sleep. And if you remember, before the new antihistamines came out, the new antihistamines on the market, like Claritin, those medicines supposedly don't make you sleepy. It's a different type of an antihistamine. This is an old antihistamine that makes you very sleepy. People don't tend to use it anymore for allergies because it makes them so sleepy, but they're using it to sleep with. And if you were to pick up Tylenol PM or Motrin PM, the PM part in that is the Benadryl, is the diphenhydramine. And you have to be cautious of that. It can make you unsteady on your feet, confused, and a potential fall problem. So we'll pass out the sheet at the end. You can take it home and read it. You can call our service if what I'm saying to you doesn't make sense and you need to get it clarified more. Certainly feel very free to call us about it. Okay, so then we have two other groups of medicines that we're just going to say a few words about for safety purposes in senior population. And this one here is proton pump inhibitors, and I'm going to have Rachel come up and talk a little bit about it. Does anybody sound familiar? You can come up, Rachel. Anybody like Prilosec or Prevacid, Protonix, Nexium? If any of that sounds familiar, perk up your ears. That's what this is about.
Okay, like Dr. Evans said, proton pump inhibitors, they work by lowering the acid in your stomach, and they are very safe and effective if used correctly. You may have heard some problems associated with them, such as broken bones, some infections, memory, heart, or kidney problems, but these are not common problems if you use them correctly. So the proper way to take them, you should be taking them before a meal. So if you take it once a day, you want to take it 30 to 60 minutes before breakfast. And if you're taking it twice a day, you want to take the second pill 30 to 60 minutes before dinner. And these medications may reduce the amount of calcium you absorb, and so it's a small chance that this could lead to broken bones. But to prevent this, you want to ensure you get enough calcium and vitamin D from your diet and any supplements that you may take. And in order to stop taking these, you don't want to just stop taking them all at once, or you may experience some symptoms of heartburn. And so you would want to slowly decrease the dose or start taking it less frequently to help prevent any heartburn. And some other tips to prevent heartburn. You don't want to eat too soon before bedtime, so you want to stop 2 or 3 hours before you're about to go to sleep. You could raise the head of your bed by 6 inches for when you're sleeping. And you want to maintain your weight and don't smoke or attempt to quit if you are smoking. And you can avoid any foods that seem to make it worse.
Thank you very much, Rachel. I would just like to add is many people are on proton pump inhibitors. Many people need these medicines and cannot get off of them. I think the word of caution that Rachel and myself just want to make sure that you understand is that if you are on a medicine and you don't really exactly know why you're on it because you never have GERD, you never have any problems with it. Maybe you had it once upon a time, but maybe now you don't need the medicine. So it's always good. Ask your doctor, is there a chance that I could get off of this and maybe not need this medicine? So just a word of caution. I do have a handout on that also that we're giving you. So, okay, the last handout that I also have to give you, and I'm going to have Tan speak a little bit about this, is just calcium and vitamin D in general.
So I'm here to talk about the calcium and vitamin D. So why do you need vitamin D and calcium and vitamin D? So calcium and vitamin D are necessary for your bone, for your health, for your bone. Also, calcium is essential for your nerves, muscle, blood vessels. Vitamin D can help you to absorb calcium. It also helps you to prevent the risk of falling and also risk of some cancer, and also strengthen the muscle. So how much per day? So for calcium, you will need around 1200 milligram of calcium per day, and for vitamin D, you would need around 800 IU and up to 2000 IU per day. So for calcium, you can get calcium mostly from food. A lot of food had calcium, such as dairy products, milk, cheese, also cheese or yogurt. It 1 cup of serving can provide you for around 300 milligram. And if your diet doesn't provide enough calcium, you can get calcium from supplements. So there are a lot of products in the market so that you can choose. For vitamin D, you can our skin can actually produce vitamin D if we are exposed to the sun, but it's not recommended to spend too much time under the sun because there are harmful UV light to your skin. So you can get it from food also, such as tuna, salmon, or dairy products. You also can get this supplement for vitamin D. So for the safetiness, for calcium, like I said before, you can get it mostly from food, and if you need more calcium, you can get the calcium from supplements. So you might have heard that some news saying that calcium supplements are not safe, but they are not really strong evidence saying that calcium supplements are not safe. So you still can take calcium supplements, but try not to rely on the supplements because it could be better for you to get it from food. And if you choose the supplements, try not to use the calcium supplements that are made from coral or dolomite, because these may contain some metals such as lead, which is harmful to your body. And for vitamin D, many people don't have enough vitamin D, and also it's hard to get vitamin D from food. So you can get it from supplements, and it's generally safe for you to get the vitamin D from supplements. There's no evidence saying it's not safe for your health.
Thank you, Tan. Yes, many of you do take a calcium with a vitamin D in it. When you take a calcium with a vitamin D in it, you get about 400 units. So sometimes they'll check your D level and they'll tell you, you know what, you need to take some extra D. So then you can go out and you can buy D3. That's usually what you buy, those little gel capsules that you see, 1,000 units, and your doctor may say, I want you to take an additional 1,000 a day, or I want you to take an additional 2,000 or 3,000. And vitamin D is very safe. You can go up levels on that. It's very good to take. Calcium, on the other hand, many of you were taking, as I say, calcium with vitamin D, but some of you now have been told by your doctors, you can stop the calcium tablets. If your diet is good, and as Tan said, you need 1,200 milligrams of calcium a day, and 300 milligrams are in a cup of yogurt, you can see that the diet really is pretty good to give you what you need. You may not need to take a calcium tablet. Maybe you can cut that out and just take a vitamin D. Good thing to ask your doctor about when you go for your annual checkup and see where things are with that. So. Okay, costs, we always like to say you can call our program. We help with Prescription Advantage. We help with Medicare Part D issues. I have a brochure I'm going to leave here, and it talks about the upcoming Medicare D season that will start. You'll be able to have your plans evaluated October 15th to December 7th for the following January of 2017. But it's always good to have your meds reviewed. Make sure they're going to be covered on the plan that you're on. Make sure if you qualify for Prescription Advantage, a very nice state program that I'm sure Marcia has had many Shine counselors here talking about, speak up. Call our service, call Marcia, call the Senior Center here, call somebody. Don't not take your medicines because you can't afford them. There may be ways to help. Does anybody like to use the computer to look up information? If you do, this is an excellent website. It's medlineplus.gov, right down at the bottom. The reason I like this website is you can look up anything you want on any of your conditions, If you have arthritis, you can look up arthritis, and it will go into very nice detail on that. If you want to look up your drug for your cholesterol, your simvastatin, or your Crestor, you can look that up on here. This site does not have any advertisements. It doesn't, you're not going to be on there and have pop-ups come up and try to sell you some supplements or whatever. It's a government site. Everything on here is well researched, and you can feel very, very comfortable about the information that is on here. It's also very easy to go through. So you shouldn't feel like you need a computer degree or be very great at computers to use this site. Super easy. You can make the print larger. You can find out information on senior health. About maybe 4 or 5 years ago, we came here and did a computer training program on this website. And it was well received by a lot of people here. It's awesome. I do have cards that we can hand out that has the website name on it. But we do have this now on this slide, so it'll be on the cable channel too. But excellent website. Certainly, Mayo Clinic is also very good if you use that, or Cleveland Clinic. A lot of people like that as a website. That's also excellent information on those two sites too. But pretty partial to this one. Questions? Anybody particular questions on anything we spoke about today? As I said, we will go around and give out our handouts. If you have individual questions at that point and you want to speak to any one of us, certainly feel free to do that. So, thank you very much.